Welcome to Community Connections. I'm your host, Mirchaye Sahlu. In this episode, we're focusing on how first-hand community engagement is shaping policy decisions around health and human services in Montgomery County.
Laurie-Anne Sayles, Chair of Health and Human Services.
Since becoming chair of the Council's Health and Human Services Committee.
Hello, hello.
You want to sit down?
Yes, since I'm invited.
Councilmember Laurie-Anne Sayles has made it a priority to get out into the community to see, to listen, and to learn.
The number of residents that are 60 plus in Montgomery County is growing at a rate of 28% in comparison to the under 60 population, which is growing at a rate of 7.6%.
Shortly after her appointment as chair,
We are asking our healthcare system and providers to do more with less.
Councilmember Sayles began touring health
A lot of diabetic medication.
and human services facilities across the county,
So we are giving Councilmember Sayles a tour.
meeting with providers, frontline staff, and partner organizations.
Any ideas, feel free to share them with me.
At the Montgomery County Crisis Center, she learned about the behavioral health and crisis response and the strain those services are under.
Well, we are very grateful that you are visiting with us today.
I thank you for having me.
Crisis Center, this is Marcy. May I help you?
It's pretty simple room, but this is our operations room, the heart. All of our staff are answering our crisis phone lines. The crisis center is open 24/7. We have many individuals coming in and out of the building at all times. We have 52 merit staff here at the crisis center, frontline staff, and then we have an additional 12 to 15 at any given time PRN staff who work as needed. Have licensed clinicians as well as peer recovery specialists. We do a lot of family work so that we can hopefully transition individuals successfully back home if that's an appropriate option. And our success rate is commendable. Our staff work very, very hard to prevent unnecessary hospitalizations. It's the very rare exception that an individual would need to be transferred to a hospitalization from stabilization or residential crisis.
Well, I hear that you may be dispatched to a call. Is this the MCOTS team right here?
One therapist and our peer recovery specialist, and
Okay.
it looks like Vicki, our supervisor, is giving them the details of the call.
Okay.
So they will be heading out, I'm sure, very shortly.
Yeah, this is actually a collaboration with CPS upstairs, so,
Oh.
they call us in sometimes to support them. It's one of those situations. Yes, ma'am.
Thank you, ladies.
Thank you.
In this building, 24/7 security.
24/7 county security. We also have a separate county security officer who oversees our stabilization room. So we do have security here on site. We're going to continue on to the stabilization unit now. We're lucky to have the continuum of crisis services here at the Crisis Center. We have 4 recliners for adults 18 and over. We like to keep a simple environment for cleanliness, sanitation, safety. We have clients who can be pretty creative with what they use to try to self-injure. So we do want to make sure that anything like adhesives or anything sharp, like pins or thumbtacks, anything like that, we can't, those types of things. Even paper can be used to self-injure. So we keep a very minimalist environment for our behavioral health clients. We're going to go to the left.
All right.
And this is
Hi there. Hello.
Charlotte Taylor. Good to
Charlotte,
meet you.
very nice to meet you, Councilmember Sayles. So I don't know how many caseworkers you have here, but everyone that seeks services here, do we ensure that they are going to a place, they have a bed to sleep in, or?
Yes.
Okay.
That's the goal, is to really make sure folks are maintaining themselves in the community. So we provide resources, financial resources to help folks to stay in the community and avoid coming into shelter.
Who's all this artwork?
These are art pieces by Trauma Services. So clients who have been through our domestic violence services, it's now on the 4th floor, but they do have some artwork that we are lucky to have. This is our family room. So this room is a little bit more, family friendly. We have toys and some activities to keep our young visitors occupied. The Crisis Center does provide the crisis assessment for individuals entering our trauma services shelter. So for individuals fleeing intimate partner violence or sex trafficking or some other type of traumatic situation, we're the point of entry into that system. Okay. So we often have individuals who are here 24/7 with little ones who are understandably very stressed. Yeah. And so we try to do the best we can to provide some distraction and some joy where it can be found. Everyone who's here is here voluntarily, so they agree to a treatment plan when they arrive. We have 4 gentlemen who are staying with us. The advantage of having our residential crisis program in-house is that we do work hand in glove with our other county partners. Also, because we have 24/7 therapist coverage here, we tend to admit individuals who are considered too high acuity for other residential crisis programs. So we have a small but mighty team here.
Montgomery County President, this is Laurie-Anne.
So we receive.
She toured an emergency housing location with Chief Christine Hong of the Services to End and Prevent Homelessness, getting a first-hand look at how emergency housing and support services are being stretched thin.
All right, so thank you, Director Hong, Dr. Bridgers. Homelessness and the unhoused population is so important to us, and we know that the largest part of our budget is with the Health and Human Services Department. I'm glad we were able to at least view some of the short-term housing facilities that we do have on site to help those in need.
And as you know, the motels are an important part of our sheltering work for families. Because we don't have enough housing and our federally funded housing is at great risk of being cut. We spend more than $4 million a year on sheltering families in motels. One of the best ways to understand our work is to come out and visit, so we appreciate that very much.
My mother worked in domestic violence at the shelter right in Bethesda. Yes, and she brought us there every Christmas to pass out the gifts to the other residents. We grew up together, so.
With the HUD NOFO being withdrawn, they were looking to cut 70% of our funding. We have close to 800 people in that housing in our county, many of whom have disabilities. These are basic motel rooms that don't have full kitchens, and so families need to feed their children.
Okay.
And yeah, this is it. So you see, it's a mini fridge and a microwave, and there's very little room for storage of food. So when families have food in their rooms, it attracts rodents and pets.
We've had company that's treated all the rooms actually this month.
Okay.
We did get all the rooms treated this month.
Okay. And does that include for bed bugs?
It does, they do.
And they look new, they look clean. This looks new. It's not intended for long-term sheltering. Very short.
And how long is an average stay for a family?
The average length of stay across our system is about 140 days. For families, so that's across individuals and families. For families, it's a little more in the 150 days. So we're talking about 4 to 5 months.
And so for a unit like this, how many people what would the maximum amount of residents be for a family?
For a family, it could be a mom with 1 or 2 small children.
Okay.
Or a mom with 1 school-aged child.
It's important for us to have a core of landlords willing to work with us, because then they can work with us in a way that is more housing first to help lower barriers. As a local funding source, Montgomery County is very reliable, and so for landlords that is a benefit. And then in addition, many of our housing programs have case management, so if there are challenges or needs for support for any family or household, that those case managers are skilled and trained and can provide that support, can work with landlords to make sure that they're stable in their housing.
If someone needs immediate shelter and there's availability, like we should be prioritizing those families.
And any of the families at the motels who have lost housing and their children are enrolled in community schools, we can make a referral to that program and they can receive rental assistance to help them with housing.
We want to ensure that our unhoused residents, have places that are dignified. It's still taxpayer dollars, so whatever we can do to support you, keep our residents safe while they're here, and keep you all safe as well.
Across every stop, a consistent message emerged. The need was growing, and the safety net was fraying.
These patients, some of them can't speak English. In an average clinic, you can get rid of a patient in 15-20 minutes. Our average is more than an hour.
Good morning, everyone. Thank you so much for being here with us this morning.
Then Councilmember Sayles held a press conference in Silver Spring to announce a $1 million special appropriation to the county's fiscal year 2026 operating budget.
In announcing this $1 million appropriation to prevent temporary harm from becoming permanent damage is so important.
Aimed at stabilizing services,
really filling in the gap for our residents that need these services the most at a time where we are seeing increasing challenges
for seniors, families, and vulnerable residents.
Just want to remind us about the egregious cuts to federal funding that's directly harming our seniors and vulnerable residents here in Montgomery County. These reductions in local services and support are unacceptable.
The resolution was co-led by Council President Natalie Fanny Gonzalez, along with Council members Sidney Katz, Kristen Mink, and Will Joando, signaling broad support across the council.
This emergency appropriation is our response, and it sends a clear message. Aging in place with dignity is not a luxury. In Montgomery County, it is a promise that we keep. After being appointed chair of the Health and Human Services Committee on December 9th, I took immediate action by touring our Department of Health and Human Services.
Those are for Montgomery County patients, which we give them free.
What I observed was a dedicated workforce doing everything they can to protect residents while facing overwhelming challenges. Reduced federal support, rising costs, and escalating demands for services. The situation is unsustainable and the consequences are clear. Programs that allow seniors to age in place with dignity are being dismantled. Families are being pushed to the brink.
The mission of Aging and Disability Services is to affirm the dignity and value of seniors. We have national advocates that are working hard and having those conversations on the Hill to get it reestablished.
The proposed earmark for the senior nutrition program will mean that many of our older neighbors will not have to choose between eating and other necessities.
He likes to go to different centers to get different meals. So he likes a variety. So he wants more flexibility.
The $1 million special appropriation delivers immediate intervention in 3 critical areas. First, $450,000 will be dedicated to senior nutrition to reopen access to these meals. Second, $300,000 for home care services to reduce wait lists. And third, $250,000 for respite care to provide thousands of hours of essential support to families who urgently need it.
So we are bringing everybody together to talk about those challenges, whether it's in our youth, whether it's aging and disabilities.
Yes.
So what is the most wonderful part of this is the partnership we have with all of the chiefs of DHHS. They are willingly not just coming to a meeting, but actively involved in helping try to solve the challenges.
Money is there. We just need the voices to amplify the ask.
A public hearing on the appropriation was recently held.
And first, I want to thank Councilmember Sayles for her thoughtful approach as she's taken on the role of chairing the HHS committee. I really appreciated the opportunity to share information with you.
Today's proposal reflects our county's strong commitment to its older adults, and we applaud you for working quickly to put it into law.
Visit the council's website to sign up for updates or to submit testimony about this appropriation or any other topics discussed across the 7 committees. Well, that does it for this edition of Community Connections. I'm your host, Mirchaye Sahlu. Thanks for watching.